This exam is the patellar apprehension test and is found to be positive when a patient has a recurrent dislocation of the patella. The patient is placed in this position with the knee hanging off the exam table. Using one hand, you grab the patient's ankle, and with your other examining hand, you put slight pressure over the distal quad and put your thumb over the patella. As you range the knee, passively, you put pressure on the medial patella, pushing laterally. If this patient suffers from patellar laxity, the patella will want to sublux or dislocate, and this again is a sign that you can see both physically on the extremity and by watching the patient for any type of apprehension. The next test is the passive patellar grind test. With the patient lying supine and the leg and the knee fully extended, you passively range the knee to full flexion and full extension, keeping your hand over the patella and feeling for any type of grinding sensation, or if the patient complains of pain with this motion. This will be positive in patients who have patellofemoral pain syndrome or other pathology consistent with the posterior patella, the distal femur, and the tibia as they articulate through the range of motion. Next exam is the Lachman test. The Lachman test checks for ACL stability of the knee. The patient, again in a supine position with the leg fully extended, is brought to approximately 20 degrees of flexion. One hand is in the distal femur region and one in the proximal tibia. At this point, you will move the hands in opposite directions, attempting to feel for translation of the tibia away from the femur. This can be felt with the examiner's thumb if it is placed at the tibial ridge. Any motion of greater than 2 millimeters of anterior translation indicates some pathology of the ACL, the anterior cruciate ligament. The next exam is the anterior and posterior drawer of the knee. The patient is lying supine. The knee is flexed to approximately 90 degrees. The examiner will sit at the level of the foot to provide some stability, and using the hands will anteriorly translate the tibia and again posteriorly. A positive anterior drawer test would be demonstrated by translation of the tibia from the femur and an indication of an ACL injury. Posterior translation is an indication of a posterior cruciate ligament injury or PCL injury. If a patient is suspected of having a PCL injury, then the quad active test is done similar to the anterior and posterior drawer test. The patient is held in approximately 90 degrees of flexion at the knee with the foot stabilized by the examiner's leg. At this point, a small divot would be seen at the tibia in relation to the knee, showing some posterior translation while at rest. Stabilizing the lower extremity, the patient is asked to tighten up their quad. As the quad tightens, the posterior translation of the tibia will reduce and the tibia will move anteriorly. Once relaxed, the tibia would again move posteriorly. This indicates a PCL injury. Next examination is varus and valgus stability of the knee. This is done with approximately 30 degrees of abduction at the hip. The patient's extremity is in full extension, and passively, using one hand on the lateral knee and one hand at the ankle, a force is applied to open the medial aspect of the knee joint. And then this is reversed to check the lateral collateral ligament by changing the position of the hands and putting a lateral force by the hand at the knee. Motion at the joint can signify an MCL injury if there is motion medially and an LCL injury if there is motion laterally. This should be checked contralaterally also, and this is for those patients who have laxity in the knees and is normal for their joints. Okay. Next exam is the McMurray's test for a meniscal injury. The patient is in a supine position with their knee fully extended. Using one hand, you cup the foot, and the other hand gently raises the knee. This is a passive maneuver. The patient is asked to relax. The fingers are kept at the joint line, both medially and laterally. Full flexion with internal rotation and extension is a medial meniscus injury if positive. Full flexion with external rotation and extension signifies an injury to the lateral meniscus. Now, having said that, the patient may be tender or complain of pain through the entire motion if the if the meniscus is injured. Also, positive exam would be either pain or a click with the motion. And this test should also be checked bilaterally to check stability and compare to the injured extremity to the non-injured extremity. Apley's compression test. The patient is laying prone. The knee is flexed to 90 degrees. A gentle pressure is applied downward at the heel to elicit pain. Internal rotation and downward compression would signify a lateral meniscus tear. External rotation and downward compression will signify medial meniscus tear. If the patient complains of pain just with downward compression and or external and internal rotation, this test can also be positive for patellofemoral pain syndrome, which is a degenerative process of the posterior patella.